This is Ricky Sahu. I'm CEO of One Up Health. I don't actually see my video, Sebastian, so are we sure it's working? Okay, there we go. All right, cool. So, wow, what a year it's been. Actually, it's been 15 months since we had the last virtual health conference in 2020, when the effects of COVID were a lot more uncertain. And we are hoping to be in person just in a few months, but of course that wasn't the case. And COVID has dramatically altered our day-to-day, from the most serious reasons, if you or your loved ones contracted it, to maybe a better work-life balance if you have the flexibility of working from home. And although COVID did take the cake on a number of headlines, what we wanted to do with VHC was spotlight this fundamental infrastructure that is being used to shape healthcare. And I believe everyone speaking and attending today is playing a huge role in setting this foundation for an improved healthcare experience throughout our country in a very different way. And this movement is really setting the bar for the rest of the world. There's nowhere else that has healthcare, clinical, and claims data coming together in the hands of consumers and applications like it is here in the United States. We should be really proud of that. And that's why we're super excited to have Alex and Steve from our federal government dive deeper into this topic at hand. And for those less familiar with the space, what I mean by the topic at hand is that on July 1st, just 1 week away, hundreds of health plans are required to meet requirements from CMS to enable Medicare and Medicaid members from their insurance companies get all their claims and clinical data via new standards called FHIR. And additionally, there are similar regulations for anti-data blocking for health systems that require the clinical data must be provided access to. And if you're here and in the know, I'm sure you've been working furiously over the last few weeks to months to make sure you and your organizations meet these deadlines. And I can say I know that firsthand with our team, who have had a bunch of late nights working with plans to make sure that we all meet these timelines just 1 week away. And ultimately, we believe that this will be extremely beneficial for the industry and for patients and members dealing with healthcare day in and day out. These CMS requirements are built on top of similar requirements from the ONC, where providers must make their clinical data available to any app of the patient's choice. And it's really the first time that both sides of the equation are coming together, and that's super exciting. In addition to our friends from CMS and ONC, we have a number of other speakers and panelists who will be building more towards this connected ecosystem and experience in healthcare. And they are representing the most prominent health plans in the United States, all the way to applications that are just getting their start, making data from these APIs more consumable by patients and their care teams. And these plans and apps will really be creating the future for the industry. But while we keep our eyes on the future, and all the opportunity that lies ahead, I wanted to make sure that we step back and really reflect on what the industry is doing here. And it's not just healthcare technology, as an industry that's being impacted. It's really the broader, healthcare industry in general. Numerous conversations are happening about how interoperability requirements are creating opportunities for improved research, patient experience, quality, medical billing practices, but that's just the start. This standard is spreading like wildfire. Can't have a FHIR conference without at least one good pun to kick it off. And across HHS, there's a broad set of applicability. First ONC and CMS really took a hold of this. And now CDC, NIH, FDA, AHRQ, they're all working with FHIR already. And from the industry side, it started with providers and applications, but what we're seeing with these new regulations is that health plans have a huge take in this industry now. And they are really diving deep with FHIR and really taking it to the next level with the combination of claims and clinical. Pharma, researchers, device companies, and many others are also starting to work with FHIR. So this is not a toy project anymore. FHIR has truly arrived, and it is a unifying thread across the healthcare industry. And all of this data coming together in a format that is shared will help us uncover new opportunities to live longer and healthier lives. Ultimately, that is the goal. And I believe that FHIR and the people working in the industry will help us get there in a more efficient manner. And just look at what's happening to the clinical side of FHIR. The original intent was for health systems to make their data available via standard APIs so that Medicare and Medicaid patients could access data and apps of their choice. But that quickly went from Medicare and Medicaid patients to all patients of these health systems. And then not only applications that were for one patient at a time, but for applications that were for entire populations or for provider-facing tools. And then we got all these EHR app galleries, which were providing applications that face doctors and clinicians so that they can interact with their patients. And what we saw was that application developers started creating calculators, alerting tools, and it enabled health systems to really take a different level of control of their data, because now, this one EHR and this other EHR could finally speak with one another, or this one application didn't have to develop against a proprietary method of interacting with the EHR data, but could build once and start deploying across many different organizations. So it's really changed over time. And what we're seeing now with US CDI and FHIR bulk data is that it's making it easier to integrate and connect entirely disparate systems of record. And these new CMS regulations, the claims data is becoming more and more incorporated. And the same sort of trend is likely going to follow suit, where it starts with a small group of patient-facing solutions for Medicaid and Medicare. It'll grow from there to likely the entire population, and it'll grow from there to not just patient-facing apps, but population-level applications. And I think that is why the impact for healthcare IT is just so broad. Everyone here today is providing leverage to every other participant in the care setting. And this technology makes it possible for one doctor to do far more. But if it's not designed well, or with the intents that don't serve the user, but another master, like reporting requirements or other mandated compliance, then obviously technology can get in the way. So I think we all have a duty here to think of the problem holistically and try and arrive at improved solutions over time. And I believe we'll see that over the next few years as more of these requirements fade into the background through automation by technology, by being built on FHIR, especially with regard to the communication between payers and providers, where now both of them are able to speak FHIR. And now that we'll be seeing this data across these systems in the same format, payers and providers will be able to collaborate on patient care in a much more understanding way than they've been able to do so in the past. And this will manifest itself streamlining prior auth, identifying gaps in care, helping guide providers and payers to those decisions that will ultimately improve quality and costs. But like I was saying earlier, the applicability of FHIR is becoming very broad. We see many more participants in the industry, and they're all contributing to the conversation. So the next 3 to 5 years will be extremely exciting. There's much more data that's also becoming part of the equation. This includes sensor data, genomics, pathology, radiology imaging, patient-reported outcomes, and there are FHIR ways to do all of those things. And that the other part is that FHIR is not just the API, but it's also providing a data structure. And for those things that are beyond the API, like analytic use cases, we're seeing FHIR still be used as a data model in the format, but research, analytics, machine learning, they all need tabular data. So this which is not the FHIR RESTful interface. So this congress of machine learning with all the data built on FHIR will truly revolutionize the industry, and I believe that that's where some of the most interesting opportunities lie. And the last thing I want to do before introducing our first speaker is give a huge thanks to all the people that have helped set the standards and collect enough critical mass in the industry so that the flame didn't die out. Pun intended again. Actually, if you want more FHIR puns, Steve is usually pretty good about that, and he'll be coming up after Alex. And these people are like Graham, Grieve, Ken Mandel, Josh, Dan, Anish, all our friends of the work groups at DaVinci, Karen Alliance, the Fireball Alliance, and many others at HL7. And it is truly hundreds of people that have contributed in getting us here, and thousands if you're thinking about all the folks that are now working hard to get live or have been working on the provider side previously with FHIR. This is, not a small thing anymore. And there's far more to come. So, all right, let's get into this. So, like I mentioned, today we have the best minds talking about FHIR interoperability. We're kicking off with Alex Muggy from CMS and Steve Pozniak from ONC, both of who will be speaking about the regulatory environment. And everyone listening can post questions in our YouTube's live stream as a comment, and the OneUp Health team will help bring that up to those speakers. So if you have any questions around what's being enforced, how it is, when it is, all that stuff, which I know a lot of people have on their minds, please feel free to ask. And then after that, after the regulatory kickoff, we have a panel with a few health plans speaking on going live with patient access APIs. So a lot of other people on this call are in the same boat. So you'll get a taste of what it is, behind the scenes at other organizations. And then, after that, Kyle and others from the OneUp team will be talking about testing these APIs. Then we'll have a panel of apps moderated by Anish Chopra, who are actually building tools and services on top of these for patient-facing access. Jocelyn and Linnell will be representing a large coalition of health plans from the DaVinci Group, and will provide more insight into that, Gravity and ONC FAST. And then finally, we'll close out the day with payer to provider data sharing via FHIR from Matt Tang and Paul Kamel from Aetna and Oscar Health. And then Joe, our OneUp COO, will be closing us out for the day. So now for the first speaker, Alex Muggy, who was here at VHC last year. Welcome back, Alex. Alex is the Deputy Chief Health Information Officer and Director of Health Informatics and the Interoperability Group at CMS, where she and her team have led the agency's interoperability and health IT efforts under the office since 2018. And basically their mission is to promote the secure access and exchange of electronic health information to support informed decision-making and make us, create a more efficient healthcare system. She's been with CMS since 2010, the whole time focused on healthcare IT. And, I don't know if we could have had a more appropriate person to be kicking off our event. So Alex, please go ahead and take it away.
Thanks so much, Ricky. Let me get my slides shared here so that y'all have something